In this video, we're looking at colon cancer, which is the #3 cause of cancer death. And it really shouldn't be because we can directly visualize the colon with colonoscopy. So that is the key to tackling this devastating disease, is screening early and often, because by the time you get symptoms of colon cancer, it gets so far along it can be really difficult to treat. In fact, metastatic cancer in general for the last 50 years has only improved by 5%. Our screening is the key to this disease. So here's some screening techniques. One is a stool sample called Colorectal, which looks for like a DNA signature of the tumor cells. This is better than nothing, but the gold standard is the colonoscopy, where a scope can directly visualize the entire bowel. And if there's any polyps there, it can actually grab the polyps in real time, bring them out for a biopsy, and see if it's cancerous. So every cancer of the colon starts with a polyp, but not all polyps are cancerous. So it's important to remove these and check them out. I put Sutab up here because apparently one of the worst parts of a colonoscopy is the bowel prep. There's this terrible drink that you just have to drink tons and tons and tons of to prepare, or you can take about 20 tablets, and it's apparently a lot better from what I hear. So again, catching it early is the key. Screening is the key to colon cancer. The more cells you have, the more mutation burden you get, the more heterogeneous the cells are, and they become resistant to like chemotherapy and other treatments. So you really want to avoid that metastatic disease. In fact, stage 3 colon cancer has a 5-year survival rate of about 65%. So stage 3 is where you have cancer of the bowel and it's moved to the lymph nodes. Stage 4, where it goes one more step up to the liver, metastasizes to the liver, 0% survival rate at 5 years. So the earlier the better. Colonoscopies can catch these in stage 1 and you never have an issue. So here's some risk factors. Age, these top ones are non-modifiable risk factors. As you get older, you just have more cancer. Family history, if you've had familial adenomatous polyposis or Lynch syndrome, that's only about 5% of colon cancers, but you would want to move up your screening. Right now, it's recommended to screen at 45 years old if you don't have any type of family history. But if you have a family history, then you'd want to bump up up to 40 for your testing. And then inflammatory bowel disease, this would be ulcerative colitis is the main one, but also Crohn's disease. These are your 2 inflammatory bowel diseases. They predispose you to colon cancer, and you'd want to, again, bump up your screening to 40 instead of 45. Some modifiable risk factors include diet. You want a high fiber diet, and you want to minimize the amount of processed meats like salami and pepperoni. Smoking is a risk factor for every cancer, including colon cancer. Alcohol is associated with colon cancer, and obesity is a risk factor for cancer. Obesity just really, especially visceral adiposity around the belly, really gets the inflammation going and makes an environment that's conducive to cancer. You could look at BMI. Anybody over 30 is supposed to be obese, but that's really not a good indicator if somebody has a lot of muscle mass. So a better index would be a waist to height ratio. So if somebody's 6 feet tall, you wouldn't want their waist to be any more than half of that. So anything over 36 inches would represent a lot of visceral adiposity. So that's kind of a better gauge. Let's look at symptoms. By the time you have symptoms, you're probably to stage 3, but still the earlier the better. Weight loss is a symptom in a lot of cancers. Unexplained weight loss without any kind of intentional diet. Pain, abdominal pain, this is usually diffuse across the lower quadrants of the abdomen. And then blood in the feces or stool. So melena is where you have like dark, black, tarry, smelly stools. And hematochezia is like a bright red stool where the cancer maybe is in the rectum area. So colon cancer includes the rectum and is sometimes called colorectal cancer. And then you can also have occult. That means the blood, you can't see it visually, but with a stool test, you can actually see it. So that would take a stool test to find the occult blood. Alternating diarrhea and constipation, just back and forth, that's a red flag for colon cancer. Bowel changes. If you imagine the lumen of your colon, if that cancer is starting to kind of protrude into the lumen, the caliber of the stool will be much smaller. It can even be like pencil-like. So if the caliber of the stools start getting smaller and smaller, that's a red flag. It can keep going until it completely closes off the lumen of the bowel and cause a bowel obstruction. And this is the leading cause of bowel obstruction in the large bowel. So tenesmus is another symptom. This is like the urge to evacuate, and it just kind of stays there even after evacuation. So that's another symptom. So these are the symptoms. This is where it gets pretty far along, but still catching on to these early is better than nothing. Knowing what risk factors we can modify, and then knowing that the key is screening with colon cancer.